If you think perimenopause is just, your body slowly and quietly running out of hormones, you are actually completely wrong.
Oh, yeah, entirely wrong.
Right. I mean, it is not this peaceful, slow fade into the sunset at all. It's a chaotic, high-volume hormonal finale.
It really is a roller coaster.
Exactly. And if you have been staring at that neat little graph in your period tracking app, wondering why it suddenly looks like it's completely lost its mind, like jumping from 20-day cycles to missing months entirely, your app isn't broken.
No, it's definitely not broken. Your body is actually speaking a highly specific diagnostic language.
And today we're going to teach you exactly how to translate it. Welcome to the deep dive. We're exploring how you can use the wildly unpredictable patterns of your menstrual cycle to pinpoint exactly where you are in the perimenopause transition.
Yeah, we're moving completely away from seeing these irregular periods as just a random, frustrating annoyance. The data you log on your phone is actually a master key to understanding your own biological timeline.
Provided, the specific rules to look for, right?
Exactly.
And we have a massive stack of medical literature to help us decode those rules today. We are synthesizing the internationally recognized STRAW plus 10 criteria that stands for the Stages of Reproductive Aging Workshop, along with the clinical guidelines from the Academia and the British Menopause Society.
We're also pulling in some really crucial tracking metrics from the Cleveland Clinic, plus some groundbreaking research from endocrinology experts like Dr. Geraldine Pryor.
Which is fascinating stuff.
Yeah.
The mission for this deep dive is really to empower you to look at your diary and understand the hidden messages in your cycle without, needing a medical degree. Okay, let's unpack this.
I love that. Let's do it.
Before we can figure out what to actually look for in the app, we have to tear down this massive misconception about what is happening in the body, because the conventional wisdom most of us grew up with is, well, it's completely backward.
It is. The prevailing narrative, which honestly even dominated medical circles for decades, has been that menopause is simply the steady decline of estrogen.
Right, the assumption is just you're running out of eggs, so you must be running out of hormones.
Exactly.
The classic analogy of a car slowly running out of fuel and gently gliding to a stop on the shoulder of the highway.
Yeah.
But look through Dr. Geraldine Pryor's research, that image is totally wrong.
It's completely flawed.
Instead of a car running out of gas and gliding, it's more like the driver slams the accelerator to the floor, the engine starts wildly revving, the RPMs are in the red zone, and then it just suddenly stalls.
That is the perfect way to describe it. And to understand why that engine is revving so aggressively, we have to look at the communication loop between your brain and your ovaries.
Okay, break that down for us.
So in the medical literature, this is called the hypothalamic pituitary ovarian axis. It's a very tightly regulated feedback loop. The brain, specifically the pituitary gland, sends out a hormonal signal called follicle-stimulating hormone, or FSH.
Right.
This FSH travels down to the ovaries and basically knocks on the door of your ovarian follicles, telling them, hey, it's time to prepare an egg for ovulation.
So it's a prompt.
Yeah. And as that egg matures inside the follicle, it produces estrogen. That estrogen acts as a return signal to the brain, basically saying, message received, we have an egg maturing, you can stop shouting now.
So the brain hears the estrogen, lowers the FSH, and everything stays balanced.
Right. It's a polite, highly coordinated conversation.
But then perimenopause hits.
Exactly. As you enter perimenopause, the sheer number of viable ovarian follicles you have left begins to decline significantly. And the ones that are left, they become somewhat resistant to the brain's signals.
They're hard of hearing.
They are. They're hard of hearing. So the brain sends out its normal amount of FSH, but it doesn't get that polite message received estrogen signal back in a timely manner.
So the brain panics.
It absolutely panics. It assumes the ovaries just aren't listening. So it breaks that normal polite feedback loop and starts absolutely shouting.
By pumping out massive, relentless amounts of FSH, it basically grabs a megaphone.
Yes. And this massive spike in FSH aggressively overstimulates the remaining follicles, whipping them into a total frenzy. Wow.
And those overstimulated follicles respond by pumping out incredible amounts of estrogen. This is the paradigm shift. Dr. Pryor's research highlights early perimenopause is actually characterized by erratically high estrogen levels, not low ones.
Which completely flips the script on how we understand our symptoms. I mean, if you are tracking your cycle and suddenly you are overwhelmed by incredibly intense physical changes, like your breasts are painfully sore and lumpy, your flow is suddenly way heavier than it was in your 20s, or you're waking up totally drenched in night sweats, It is not because your hormones are quietly packing their bags and leaving.
No, not at all.
It's because they are throwing a chaotic high estrogen finale.
And, that high estrogen environment is compounded by another massive shift. Because of this chaotic overstimulation from the brain, the actual event of ovulation becomes way less frequent.
So you gear up to release an egg, but you don't actually drop it.
Exactly. And when you don't ovulate, your body fails to produce progesterone for that cycle.
Ah, right, progesterone. Yeah, progesterone is the hormone that normally swoops in after ovulation to counterbalance the estrogen. It's the calming, stabilizing, organizing force in your cycle.
And so you have the accelerator, that massive surge of estrogen pressed all the way to the floor, but the brakes, the calming progesterone, are completely cut.
Precisely. Unchecked, wildly fluctuating estrogen is the primary driver behind those intense erratic symptoms. You are strapped into an estrogen roller coaster.
And that profound mechanical shift completely changes the data you are going to see in your tracking app.
Oh, absolutely. It's a totally different pattern.
Let's translate that internal biology to the screen on your phone. Because wait, if the factory is running out of eggs and the follicles are getting resistant, shouldn't the cycles be getting longer?
You would think so.
Right. Logic would tell you things are slowing down, so your periods should get further apart. But looking at the straw criteria, and really just the reality for millions of women, periods actually start coming much faster.
It feels totally counterintuitive until you remember the brain with the megaphone. In the straw plus 10 staging system, this phase is officially designated as stage nWhile 2, the early menopausal transition.
Okay, stage nWhile 2.
Right. And the defining hallmark that you have entered the specific stage is a persistent difference of 7 days or more in the length of consecutive cycles. In clinical terms, we call this the 7-day rule.
Meaning if your baseline cycle for your whole adult life has been, say, a reliable 28 days, and you look at your app and see your last 3 cycles were 21 days, then 30 days, then 20 days, you're officially looking at the 7-day rule in action.
Exactly. Because that megaphone of high FSH is putting the ovaries into such intense overdrive, the follicles are being forced to mature far too quickly. It's a rush job.
They're rushing the assembly line.
Yeah. And this incredibly accelerated follicular phase is what causes the entire menstrual cycle to compress. So it is incredibly common for women in early perimenopause to see their cycles drop to less than 21 days. The conveyor belt isn't slowing down yet. It's been cranked to double speed.
But just because the conveyor belt is running at double speed, that doesn't mean a finished product is actually coming off the line, right? Having a period doesn't mean you're releasing an egg.
What's fascinating here is the rise of the anovulatory cycle. Anovulatory simply means a cycle without ovulation.
Right.
That massive unopposed surge of estrogen we talked about is busy building up the lining of your uterus, and eventually that lining gets too thick and has to shed, resulting in bleeding. But no egg was ever released.
So if someone is just logging day 1 of bleeding in their app, how are they supposed to know the difference? I mean, to the naked eye, a period is just a period.
And this is where tracking the secondary signs becomes incredibly illuminating. The Cleveland Clinic outlines specific biomarkers that tell you whether or not you are actually ovulating.
Okay, what's the first one?
The first major tell is cervical mucus. In a normal ovulatory cycle, the coordinated rise of hormones triggers the production of a very specific, clear, stretchy mucus right before ovulation.
The one that looks and stretches exactly like raw egg whites.
Exactly, that's the one.
That egg white consistency is the classic textbook sign that an egg is about to drop. It's essentially a sperm superhighway.
Yep. But if you are logging 21-day cycles and you realize, hey, I haven't seen that unmistakable egg white mucus in months, it is a very strong physiological indicator that you are having anovulatory cycles. You're bleeding, but you aren't ovulating.
Wow. And I was looking at the guidelines on basal body temperature tracking too, and the mechanism there is just fascinating. Normally, a woman's resting body temperature is lower in the first half of her cycle.
Right.
Then right after she releases an egg, her temperature spikes slightly and stays elevated until her period starts. And the reason for that spike is progesterone, right? Because progesterone is thermogenic. It literally generates heat in the body.
That is the exact mechanism. Once the egg is released, the empty follicle transforms into a temporary gland called the corpus luteum, and its entire job is to pump out progesterone.
And that raises the temperature.
By about 0.5 degrees, yeah. But if you don't ovulate, there is no corpus luteum. No corpus luteum means 0 progesterone, which means there is nothing to trigger that temperature spike.
So you look at your app, it's showing you compressed 20-day cycles. You're looking at a completely flat basal body temperature chart. You haven't seen the egg white mucus. That is your body waving a massive, scientifically verifiable flag saying, "Welcome to early perimenopause, straw stage Yugen to 2."
It is a profound realization when you finally see the pattern match the biology.
Totally.
But that rapid-fire shortened cycle phase is really just the first act. Eventually, the internal machinery shifts again, and the data pattern completely flips.
We transition away from the 7-day rule of early perimenopause, and we move into the 60-day rule of late perimenopause.
Exactly. The physiological reality hits a wall. The ovarian reserve of follicles drops so low that even the brain screaming with massive spikes of FSH cannot reliably force a follicle to develop.
This high-speed conveyor belt finally breaks down.
Yes, the system truly starts to stall. We are now looking at straw stage MIGing 1, the late menopausal transition. The official clinically recognized marker for this stage is when you experience a gap of 60 days or more between periods.
2 full months.
Right. And when you see that 60-day gap in your app, the medical literature estimates that full menopause, like the final complete cessation of your periods, is likely 1 to 3 years away.
Okay, let's talk about what is actually happening inside the uterus during that 60-day silence. Because looking at an empty calendar on your app can make you think, well, nothing is happening.
But it's not a pause.
No, the uterus is incredibly busy.
It is. And this brings us back to the concept of the estrogen roller coaster, but now with even higher stakes.
Okay, how so?
During a normal ovulatory cycle, estrogen builds up the uterine lining. Then ovulation occurs, and progesterone steps in. Progesterone's job is to organize that lining, stabilize its blood vessels, and finally trigger a coordinated clean shedding of the tissue.
So progesterone acts like the structural engineer, making sure the building comes down in a controlled demolition.
That's a great way to put it. But during the 60-day gap in late perimenopause, there is no ovulation, so zero progesterone. But those few remaining sputtering follicles might still be dripping out estrogen.
Oh boy.
And that unopposed estrogen acts like fertilizer. It just keeps building and building the uterine lining, making it thicker and thicker, but without any structural support at all.
It's like piling heavy, wet snow on a roof. You keep adding layer after layer of snow, but you aren't reinforcing the rafters underneath.
That is exactly what it's like. Eventually, the uterine lining becomes so thick and mechanically unstable that the blood vessels underneath simply cannot support the sheer mass of the tissue anymore.
The structural integrity fails.
The roof collapses. Medically, we call this an estrogen breakthrough bleed.
And because it is a mechanical collapse rather than a hormonally controlled demolition, the resulting period is completely different.
It is often highly unpredictable, very prolonged, and incredibly heavy. The shedding is patchy and chaotic.
Which perfectly explains why so many women in straw stage Megri 1 get caught completely off guard, often in really public or stressful situations.
Yeah, it's awful.
You go 2 entire months with nothing, thinking maybe you were done, and then suddenly you are dealing with the heaviest flow of your entire life.
Right. But knowing that it's a structural collapse from unopposed estrogen removes so much of the panic, it makes mechanical sense.
It does. With all this extreme hormonal chaos happening, though, the brain shouting with FSH, the missing progesterone, the collapsing uterine lining, I feel like the immediate logical reaction for anyone going through this is to just march into a doctor's office and demand a blood test.
It happens all the time.
Like, give me a full hormone panel, prove to me on a piece of paper that I am in perimenopause so I can get some help. But the guidelines across the board say that your period app is vastly superior to a needle.
It is deeply counterintuitive for a lot of people, and honestly, it is the source of immense friction between patients and doctors. But the medical consensus is ironclad on this.
It really is.
The NICE guidelines in the UK, the British Menopause Society, the leading clinical bodies, they all explicitly state that for otherwise healthy women over the age of 45, blood tests measuring FSH or estradiol are not recommended to diagnose perimenopause.
But we use blood tests to diagnose cholesterol, thyroid issues, vitamin deficiencies. Why does a blood test completely fail when it comes to perimenopause?
It all comes back to the roller coaster. We are trying to measure a system that is in a state of violent, unpredictable flux. Your levels of estradiol and FSH are not just changing from month to month, they are violently swinging on a daily, sometimes hourly basis.
So let's paint the picture of what happens in the clinic. A woman is having brutal night sweats, her cycles have shrank to 20 days, she is just miserable. She goes to the doctor on a Tuesday morning and gets her blood drawn.
And on that specific Tuesday morning, the needle happens to catch her hormones at the precise nanosecond they are plummeting down the track of the roller coaster. The lab results come back showing her estrogen and FSH levels are perfectly within the normal premenopausal range.
So the doctor looks at the sheet of paper, looks at the patient, and says, Your blood work is totally normal. You aren't in perimenopause.
Exactly. And the patient feels completely gaslit. She knows her body is falling apart, but the science is telling her she's fine.
But if she had walked into that exact same clinic on a Wednesday afternoon,
The needle might have caught her at the very top of the roller coaster track, and the lab would have flagged her as fully postmenopausal, only for her to go home and get a massive estrogen breakthrough bleed the following week.
wow.
A single blood test is just a freeze-frame snapshot of a moving target. It lacks entirely the context of time.
So what does this all mean? It means the clinical diagnosis of perimenopause must be based on a patient's historical data, the trend line of your symptoms, and most importantly, the physical, indisputable record of your bleeding pattern over time.
Yes. Your menstrual diary captures the entire roller coaster ride over 6, 12, or 18 months. It shows the compressions, the anovulatory cycles, the 60-day gaps. The history you log on your phone is the gold standard diagnostic tool. It is far more medically accurate than any single vial of blood.
Knowing that your app is your best piece of evidence is deeply empowering. But with that power comes the responsibility to know the difference between a normal, albeit totally chaotic transition and a genuine medical emergency.
That is a very critical distinction.
Because not all heavy bleeding is just snow on the roof.
Right. While estrogen breakthrough bleeding is a hallmark of the late transition, the medical community sets hard limits. The Cleveland Clinic outlines very specific red flags that demand immediate medical attention. We have to rule out structural issues like uterine fibroids, polyps, or the risk of endometrial cancer.
Because those can all masquerade as perimenopausal symptoms. I was looking at the Cleveland Clinic's hard numbers on flow volume. They define excessive bleeding as losing over 16 teaspoons of blood during a single period. And for those of us who don't measure our periods in teaspoons, that is roughly 80 milliliters.
Right, which sounds abstract.
So in practical terms, they define a major red flag as soaking completely through a pad or a tampon every single hour for several hours consecutively.
Yeah, that level of flow volume is a hard stop. You must see a doctor, but the duration and timing of the bleeding are equally critical metrics to monitor in your app.
What are the other non-negotiable warning signs?
Bleeding that continuously lasts longer than 7 days is a clinical red flag. Any spotting or bleeding that occurs in the middle of your cycle between your actual periods must be investigated. And the absolute most critical rule, any bleeding whatsoever that occurs after you have hit the 12-month mark of no periods.
Let's clarify that definition because it's vital. Menopause is not a process. It is a single point in time. It is defined retrospectively as going 12 consecutive months without a single drop of menstrual bleeding.
Exactly. Once you cross that 12-month finish line, your uterine lining should be thin and inactive. Any bleeding after that point is considered postmenopausal bleeding, and it is a massive red flag that requires immediate clinical evaluation to rule out malignancy.
That 12-month clock also brings up a huge point of confusion regarding contraception.
Oh, yes.
Because if you are diligently tracking your app and you see that massive 60-day gap we talked about in straw stage MyGeta 1, it is incredibly tempting to look at the calendar and think, great, the factory is closed. I can finally throw away my birth control pills or get this IUD removed.
Tossing your contraception based on a 60-day gap is a dangerous assumption. All the major clinical guidelines issue a stark warning here. Even in the very late stages of perimenopause, spontaneous pregnancy is absolutely still possible.
Wait, how is an egg releasing if you've been sitting with an empty calendar for over 2 months? Like, where does it come from?
Remember the brain shouting with the megaphone?
I'm right.
Your pituitary gland is still occasionally firing off massive, desperate spikes of FSH, and every once in a while, one of those rogue surges is powerful enough to successfully coax a dormant, stubborn follicle out of hiding and force it to release an egg.
And you'd have no idea.
You will have zero warning that this rogue ovulation has occurred. You won't know until you either get a period 2 weeks later or you realize your period still having come, but now you are dealing with a totally unexpected pregnancy.
Wow. So the rule is absolute contraception is strictly required until the 12-month clock of no periods is officially run out.
The profound unpredictability of the late transition is exactly why that physical barrier or hormonal protection remains necessary. You just cannot rely on the calendar until the calendar has been blank for a full year.
But the beauty of all this tracking is the total control gives you over your healthcare conversations. By actively logging these specific metrics, the 7-day compressions in early perimenopause, the flat line of your basal body temperature, the 60-day gaps in late perimenopause, and carefully monitoring your flow volume against those red flags, you are building An unassailable medical history.
You really are.
You can confidently walk into your doctor's office, hand them the trend line, politely decline the snapshot blood test, and firmly advocate for management of your symptoms.
And armed with that specific data, your healthcare provider can actually target your treatment, whether that involves hormone replacement therapy to stabilize the roller coaster, non-hormonal therapies, or specific lifestyle adjustments directly to the exact stage of the straw transition you are currently experiencing.
It takes the guesswork entirely out of the equation. So let's do a quick recap of the massive physiological journey we've mapped out today. We completely dismantled the myth of the quietly fading ovary and replaced it with the chaotic reality of the brain's megaphone and the estrogen roller coaster.
A much more accurate picture.
We translated the 7-day rule of early perimenopause and the heavy structural collapse of the 60-day rule in late perimenopause. And we established exactly why the day-to-day data in your phone is a scientifically superior diagnostic tool compared to a single out-of-context blood draw.
It is really about shifting your mindset. You are no longer just a victim of bizarre, random bodily changes. You are an active, highly informed observer decoding the mechanics of your own biology.
You are reading the dashboard. And before we go, I want to leave you with one final, deeply provocative idea pulled directly from the deepest cuts of the endocrinology literature we reviewed.
Oh, this is a good one.
Throughout this entire deep dive, we have been intensely focused on the ovaries, running out of eggs, follicles going deaf to the brain signals. But the literature points to something much bigger. The profound aging changes that trigger this transition aren't just isolated to the ovaries.
No, they aren't. The research notes that cellular aging is occurring simultaneously in the hypothalamus and the pituitary gland, the actual control centers up in your brain, as well as inside the tissues of the uterus itself. They all actively contribute to the cascade of perimenopause.
But the wild part is, their exact roles and how they initiate this process haven't been fully examined in humans yet, which raises an absolutely incredible question. We always blame the ovaries. But what if this massive defining life transition is actually being driven just as much, if not more, by the aging of your brain?
If we connect this to the bigger picture, it reminds us that our bodies are not a collection of isolated organs, but deeply intertwined systems. The communication network is just as vital as the organs themselves. Knowledge is only valuable when you apply it. Keep tracking your data, keep questioning the old assumptions, and recognize how incredibly dynamic your system truly is.
It is absolutely something for you to ponder the next time you open your app and log a cycle. The engine might be revving wildly before the car finally stalls, but at least now you know exactly how to pop the hood and understand the mechanics.